Welcome to Maternal Mental Health in Minutes by Motherhood Understood. This video talks about the use of medication to treat pregnancy and postpartum mental health illnesses, also referred to as perinatal mood and anxiety disorders, or PMADs. Medication called antidepressants are often used to treat pregnancy and postpartum mental health illnesses. Without going into too much complicated medical speak, antidepressants work by balancing the chemicals in your brain that affect mood and emotions. When you're depressed or anxious, the parts of your brain responsible for planning and problem solving don't work well because they are overpowered by tons of intensified emotion. That's why it's impossible to think your way out of a mental health illness. Antidepressants help bring down the level of intense emotion you feel so your problem-solving brain can do its job. When this happens, it becomes easier to perform everyday tasks and fight your illness. Antidepressants set off a positive feedback loop. For example, when you feel less depressed, you have more will to participate in talk therapy or attend a support group. When you feel less anxious, you answer a friend's phone call. When you spend time with a friend, you spend less time at home thinking. You have then freed up more energy to go for a walk, all of which acts to improve your mental health. You will also be able to think more clearly and communicate your needs effectively, such as telling your partner exactly what you need them to do, like waking up and feeding the baby so you can sleep. One of the most common concerns women express about taking medications is the worry that going on them will change their personality. The answer is no. Depression and anxiety change your personality. The right medication does not, and will help you find your way back to yourself. We know how much stigma still surrounds the need to take medication for a mental health illness, so we want you to think about it this way. If you had strep throat, you would take the medication prescribed without a second thought. The same is true of mental health. We know it's scary because we've been there. Having to go on antidepressants is not what you expected when you became a mother, but it doesn't equal weakness or failure. It means you are taking care of your health, which is true strength. We know it's hard, but please have patience when starting an antidepressant because they can take a few weeks to take effect. Also know that just because you need to take them now does not mean you will have to stay on them forever, if that's something you're worried about. Making the decision to start an antidepressant should be made with your doctor. The ideal provider to see is a perinatal or reproductive psychiatrist, but your OB/GYN and regular doctor can also prescribe. If you find yourself experiencing extreme side effects or something doesn't feel right with the medication you have been prescribed, let your doctor know right away. It's possible your medication is not the right one, and you need to switch your prescription to a different option. Don't be afraid to speak up. We strongly recommend coupling medication with talk therapy because while the meds will help you feel better, you still need to work through your feelings. For a list of different types of therapy providers, watch the following video. There are many types of antidepressants, and sometimes your doctor might prescribe a combination of these medications. For more information about the different types of antidepressants and other medications used to treat pregnancy and postpartum mental health illnesses, check out our antidepressant medication cheat sheet. If you were taking medication for a mental health issue prior to getting pregnant and are trying to get pregnant, debating whether or not to stop your medication, are already pregnant and experiencing depression or anxiety, or if you are suffering postpartum and are worried about taking medication while breastfeeding, please watch the following video.